The initial vision of the Smith Center was to develop an outcomes research group that really offered something different than existed anywhere.
Dick and Susan Smith were so important to the genesis of the Smith Center. I remember Susan Smith telling me very specifically, I want you to take these resources and use them. You got to make an impact fast.
The work we do at the Smith Center is now internationally recognized, both for its rigor and relevance.
Our mission is bigger than any single research program. We follow the evidence through until it's directly influencing legislation, policies, and everyday decision-making on the clinical side. Policymakers at the highest level of government come to us for advice and guidance.
There are a lot of important clinical questions that are being worked on at the Smith Center. The analyses that are ongoing can be directly applicable and quickly realized in the clinical arena.
As physicians, we can see that firsthand, and we're ultimately the individuals who can relate that back to policymakers and say, this is what we're seeing on the ground.
We work really closely with the U.S. Food and Drug Administration to ensure that these new devices and products that we use every day are absolutely being used in the right patients and in the right way.
We're really thrilled to even work closer with the Smith Center on how we can use data to address some of the deficiencies and issues with the current outcomes of our patients with cardiovascular disease.
This is one of the most quantitatively and methodologically sophisticated groups of medical researchers that I've ever interacted with. The work that's done here will lead to better decision-making and new ideas in all sorts of medicine, not just cardiology. That improves patients' lives.
We found something that is just so fundamentally appealing and exciting to people that it's bringing out the best in already very talented people.
The most exciting part about being at the Smith Center is not only seeing the impact of one's work directly on health systems and policy, but also helping train the next generation of researchers.
Our mentorship program is one of the things that we are proudest of.
One of the founding principles of the Smith Center was to really develop, mature, and curate investigators who also were real-world practicing clinicians.
The Smith Center exemplifies what academic medicine can be at its best: rigorous, collaborative, courageous, and deeply human.
For the Smith Center, the best is yet to come. We've had tremendous growth over the last 10 years.
We're now a 50-plus person enterprise spanning everything from the innovating cardiovascular devices and evaluating them to health policy to population health.
When we have those moments of success, when we've really implemented something that's changed policy for the better, made a discovery that's going to improve the health of patients in this country, I think, gosh, Dick and Susan would be really proud if they could see us now.